Hello and welcome to the Introduction to Health Promotion and Behavioral Science and Public Health review of Chapter 10. This is Julie Zeruba Fountain, and I will be taking you through the review of the Social Ecological Framework and Health Promotion in the Healthy People 2020 initiative. So the learning objectives for this chapter, you should be able to describe the role of Healthy People 2020 and the objectives for health promotion and disease prevention. You should be able to explain the behavioral commonalities such as and across tobacco use, diet, physical activity, and obesity. You should be able to describe the obesity trends in the last 30 years and explain how these relate to healthy people, physical activity, and diet objectives. And you should understand the population level interventions that influence these health behaviors, such as environmental incentives, mass media, and social norms and regulation of access. You should also be able to give examples of the similarities in industry practices for marketing tobacco and unhealthy foods and beverages to children, and understand the influence of industry marketing in promoting unhealthy behaviors, comparing and contrasting the tobacco and food industries. And lastly, demonstrate the importance of establishing healthy behaviors during the school years. So first is a brief introduction. So I am going to go through these slides somewhat quickly, as you can find more detailed information in your book, but I just wanted to review and point out some key information to you throughout the presentation today. So some key points start with talking about the lifestyle of a person and its strong determinants of that lifestyle and its effects on the disease they will suffer. So, for example, in 2013, the New England Journal of Medicine conducted a roundtable on the role of government in promoting health and preventing disease. So, this looked at the policy level. We're talking about the individual level. So there's an intricate balance between the fact of people's lifestyle that can be a strong determinant, but also the implications of policies to support the choices a person makes. So tobacco use, poor diet, and physical activity we know are associated with multiple diseases. Since 1979, the Healthy People Initiative has set comprehensive 10-year goals and objectives to promote health. These documents provide an important historical record of health promotion and disease in the United States. So they have continued to set evidence-based objectives. This helps to provide benchmarks and monitor progress over the course of a decade. This also gives us the ability to compare different reports that enables the reader to identify the evolution in public health thinking over the past 4 decades. I use Healthy People to set priorities. I use them to allocate funds to certain objectives. I also use them to measure performance and compare my data with state and local data. At the federal level, Healthy People helps identify high priority health issues, critical areas of research, and needs for data collection. There is a very nice chart on page 281 that describes Healthy People over the years. So it starts at 1990 and goes through 2020. So I suggest you look at that chart. Now, the earliest reports focused on setting goals for behaviors, which means that they emphasized the decrease in mortality, infants through adults, and the increase in independence among older adults. Now, 2020 has shifted that focus. So the focus now is attaining high quality, longer lives free of preventable disease, disability, and premature death. It also has the goal of achieving health equity and eliminating disparities. So we talked about in chapter 7, those social determinants of health. That's where this comes into play. So social determinants of health and the inequities that are present in those social determinants of health, addressing that is an overarching goal of Healthy People 2020. So people are starting to realize that social and physical environments can either promote good health or promote unhealthy lifestyle changes. As I mentioned, the goals of Healthy People are to address the population level goals and interventions and actions. So they start out at the big picture, so big population level, but the interventions are and actions are required at multiple levels of society. The objectives need to address population groups across the lifespan. And the focus is on preventing the initiation of the problems, and which means eliminating those disparities and focusing on how to prevent disease. One of the goals of Healthy People 2020 is to look at society. So when we look at society, we need to look at the effect of social norms. So what are social norms? Social norms are and can influence an individual's ability to change an addictive habit. So we have seen this in the longitudinal studies of veterans of the Vietnam War. So we know that heroin use was a serious problem during the last years of the war. So most thought that it would be extremely difficult for addicts that started heroin use when they were overseas to quit once they returned to the United States. But what they found was that heroin users, for the most part, appeared to quit cold turkey, or which means they just stopped when they re-entered their former social environment. So what this means is when it was no longer acceptable, they no longer had easy access to heroin, they quit the habit. That goes into why social environment is so important. So focus on changing the social and environmental influences that impede performance of a health behavior and or social support is a problem that is a critical approach. And that's what's suggested by the social ecological framework. We want to address the social environmental influences on health behaviors. Now we're going to talk a little bit about specific and major health objectives in Healthy People 2020. I am going to briefly review every objective and of those major objectives, starting with tobacco use. I'm going to quickly move through these slides, but it's very important that you familiarize yourself with some of these objectives. As we stated, it's a good measure to become familiar with, as you may in your work sites be using these Healthy People standards to compare your objectives at your work site too. And it's a standard and benchmarking process that many health professionals use. So tobacco use, we know, is the single most preventable cause of death and disease in the United States. There's lots of people affected by this. And that is why it is one of the main objectives of Healthy People. So we know that smoking has decreased, which is great. It's declined from 24% to 20.6% during 2000 and 2010, but there's still a way to go, as the target is 12% at 2020. Now, the prevalence among adolescents the target is 16.6%, and it has appeared to be declining, and the goal can be met if the trend continues to decline. Typically, initiation of smoking occurs between age 12 and 25. Most people, if they haven't started by the age of 25, most people will not smoke. So that is promising news. And cessation. I am a tobacco cessation counselor, and I can attest to this, that most people, it takes them an average of 6 to 7 quit attempts. So they decide that they're going to quit 6 or 7 times before they actually quit. And most people that do smoke do want to quit, but because of limited resources and ability, they are unable to do so. Nicotine is highly addictive, and it causes lots of complications when you are using smoking as your coping strategy for stress, and then that's taken away from you, and you're supposed to you expect someone to adapt to that. So it's very complicated to quit smoking, and it's very challenging for most people. There's more information about cessation on page 285 in your text. Now, cessation and pregnancy, there has been huge successes in cessation of smoking during pregnancy, which is great to see because that smoking affects the unborn child. So we've seen the rate decrease from 42% in 1990 to 10.7%, which is great. And this shows that there are ways that general policy can affect maternal smoking and can affect health behavior. Now, secondhand smoke, we know that secondhand smoke is also a carcinogen, which means it causes cancer, and that was evolved in the early 1990s. And because of that, a lot of public policies have been implemented to prevent smoking in public places due to the fact that it can affect the general population if you are exposed to secondhand smoke. Now, there are multiple interventions in play that use incentives to decrease tobacco use, and those are listed on your screen. So increasing taxes has been shown to decrease the amount of people that smoke, and then also increasing insurance coverage has been shown to be an effective intervention. So this talks a little bit more about increasing tobacco taxes. More information can be found on 287 about this. And it's thought to be the most effective way to encourage tobacco users to quit and to prevent non-smokers from starting smoking. Tax avoidance. So state taxes on cigarettes vary widely. There's 20 states that have had taxes of less than $1 in 2012, and which means that, for instance, Duluth and Superior are neighboring cities. Duluth, Minnesota, where I live, is obviously in Minnesota. Superior is our twin city, and they are located in Wisconsin. And you just have to cross a bridge. It's about 5 minutes to get to Wisconsin. So what people will do, if there's a state that has higher taxes, they will go to a neighboring state to purchase their either alcohol or cigarettes. So that's tax avoidance. There also has been an increase in insurance coverage for medical treatment of complications due to tobacco use. We know that 32.6% of adult Medicaid recipients smoke, compared to 22% of the general population. So the CDC recommends full coverage for smoking cessation to help support those Medicaid people on Medicaid that smoke. Now, there's also objectives that focus on interventions that control access to tobacco. So, for example, they want to increase the proportion of persons covered by indoor worksite policies that prohibit smoking, so banning smoking in bars, for example. They also want to increase smoking indoor or smoke-free indoor air at public worksites, and decrease access to minors. Now, most of our workplaces are smoke-free. So the EPA declared environmental tobacco smoke a Class A carcinogen, as we mentioned previously. In 2012, 34 states had laws prohibiting smoking in public places. In 2020, they hope to get that to all U.S. states. Also, it's illegal to sell cigarettes to minors, so it's important to follow up and have performance reports on which states are actually following this law. So that's what this slide is about. It's about enforcement of the policy. There's also compliance checks that should go on when checking on sales to minors, and there's been a lot of effort about youth access to tobacco products. There's also been lots of media attention to discourage tobacco use, and the goal of that is to increase smoke-free homes and to decrease exposure to smoke. So that's the goal of using media to discourage tobacco use. Smoke-free homes, we know that if you live in a smoke-free home, that there is a likelihood of success in smokers trying to quit if you promote a smoke-free home in your house. And it also decreases the chance of smoking in young. And we know if you don't smoke by the age of 25, you're probably not going to. So that's very important. And also the intensity of smoking decreases. Now, there has been a lot of marketing in the tobacco industry. So the tobacco industry is very innovative. They honestly set the standard for a lot of marketing practices. They are very good at promoting their products. Unfortunately, their product is linked to cancer and COPD and a lot of other chronic conditions that are very difficult to manage. So their substance and product is very addicting, and they know that once someone starts, it's very difficult to stop. So they are excellent at marketing that to people. So our tobacco efforts need to be comprehensive to combat and counter those marketing campaigns. The CDC has created a criteria for an effective marketing campaign that can be found on their website. This includes hard-hitting messages, sufficient reach, duration, and frequency to affect smoking behavior, because we know that it takes 6 or 7 times for someone to quit, which adds to the longevity of their smoking. Now, there's lots of interventions that take place in schools. All schools are tobacco free, but there are still people that smoke in school and on school campuses. So enforcing that policy needs to be maintained at schools. Also, schools must create an environment that encourages anti-tobacco beliefs and behaviors. There are no objectives related to regulate tobacco products, but the FDA has efforts that increase warning label sizes. Also, with the new popularity of e-cigarettes, there's efforts to block those as cessation aids, as they haven't been proven effective. And there's also state laws that regulate internet and mail order cigarette sales. Now on to another Healthy People 2020 objective. This is height or weight status and obesity. We know that obesity is linked with many health problems, and that is why Healthy People, again, is focusing on weight and obesity. You can see the objectives on the screen that focus on weight and obesity. The prevalence of obesity has increased over the past few years, and obesity is defined as a BMI or body mass index of greater or equal to 30. And adults at a healthy weight range has decreased from 42 to 31% in just a matter of 10 years. Unfortunately, we've also seen an increase in adolescent obesity rates, and we've seen that it has been similar to adult trends. Now, obesity, the onset of obesity has been seen in more than half of youth, and more than half of the onset of obesity in youth may occur during the first 5 years of life. And we know that obese children are more likely to become obese adults, and that is why it is important to intervene at an early age. And we know that most attempts to change weight are not associated with a professional program or therapy. Best practices suggest that a weight loss therapy can achieve a 10% weight loss over a 6-month period. However, without appropriate maintenance of the program, the majority of weight loss will be regained. Some strategies that you can focus on would be the important source of motivation for patients. So focusing on physicians and communication with their patients about weight loss is very important. Dietary behavior is also a very important focus, and focusing on eating less refined and processed foods is an important strategy for weight loss. We also want to increase consumption of fruits, vegetables, whole grains, and calcium. You can see on the screen that American diet is not doing great in this area. So only 4% of Americans are achieving those objectives. And you can see Healthy People is targeting on increasing those foods. There is hope in changing dietary patterns. You can be of a key influence at certain times in people's lives to change and influence their diet. So people that have a major health event may become more motivated to make major changes in diet. And if they have the adequate support, they can accomplish those changes. So the 2020 objectives aim to improve the diets of Americans and include interventions that incentivize people to improve their dietary patterns, for example, by taxing sugar-sweetened beverages. They want to increase access to healthy foods, so offering grants to fund and finance healthy foods. They would also like to use media to promote healthy eating and promote healthy eating in schools and to regulate food and beverage products. Now on to physical activity. Physical activity is also very important in managing weight. So being physically active can help control weight. It helps reduce risk factors for chronic disease. It can help fight fatigue, and it also improves muscular and skeletal health, as well as mental health, mood, and sleep. So physical activity also increases the chances of healthy aging. Lots of benefits to physical activity. So the adult guidelines, as we've mentioned before, it's at least 150 minutes of moderate intensity aerobic activity weekly, and it also includes muscle strengthening activity twice weekly. Now we see on our screen the levels of physical activity, which we've talked about in the past, so I'm not going to spend a lot of time on this, but we know that not the majority of the population are reaching those physical activity goals. Also in youth, screen time has increased and physical activity has decreased. So 10 objectives of Healthy People 2020 address screen time for children and adolescents. So that's a pretty large number to focus on one objective, and therefore it is important to recognize the effect of screen time on activity and health. So speaking of screen time and activity, also active transportation is an important feature and the development of objectives for active transportation in youth and adults as described on your screen. So children who walk or bike to school have overall higher levels of activity, better body composition, and cardiovascular or cardiorespiratory fitness. So that is where that environmental impact is large. If there is sidewalks that are well lit, if you live in a safe community, that means you can walk to school, and that can increase your health. So why are people inactive? Life events are often associated with the onset of increased activity. So once someone starts driving, once someone stops playing a competitive sport, or injury, all decrease the likelihood of someone being physically active. And how do we get those physically inactive people active? So New Year's resolutions, although I would say that most people, there's a statistic out there that only 8% of people actually achieve their New Year's resolution. So we need to do a better job of supporting people in their making those resolutions and sticking to them. Also, people need to attach a meaning to the activity that they're doing that can help increase the success. Also, having a coach or personal trainer can increase the success, and social support increases the success of people getting active again. On your screen, you will see some strategies to improve physical activity. So they suggest that tax exemptions, rebates, and subsidized programs, also development of policy and developing opportunities for workplaces to encourage physical activity. Basically, you want to make the environment easy to make the healthy choice the easy choice. So like I talked about, having walking paths at your work, having free fruits and vegetables at your work, and encouraging people to make those simple changes in life that can lead to big results. Also, you can use the media to promote physical activity. For example, the VERB campaign, which was from 2002 to 2006, targeted and positively influenced physical activity. However, the funding ended in 2006, so the campaign stopped in 2006. However, it was shown to be positive, so if the opportunity for funding existed, then I'm sure the campaign would start up again. Now we're on to the last slide, which is promoting physical activity in schools. So the expert opinion is targeting the school environment should be a key strategy. That should be a key strategy because we know that once health behaviors are started in schools, that this can be extended into development of lifelong behaviors. So we want to start targeting those schools to improve health behaviors in the goal of improving health behaviors throughout a lifetime. In summary, the government has an important interest in promoting health and preventing disease. That is why they spend so much time focusing on these Healthy People 2020 objectives. These 2020 objectives provide a key document that addresses disease prevention and health promotion issues of public health significance. We reviewed some of the objectives that have been set for the decade, and these provide benchmarks to monitor progress for various health areas. The overarching goal of Healthy People is to create social and physical environments that promote good health, highlighting the importance of the social ecological framework that inform the development and objectives of Healthy People 2020. So we reviewed the Healthy People 2020 objectives for tobacco use, diet, and physical activity, and that influences weight status, and we examined how policies can influence the lifestyle behaviors and their consequences. So once again, we focused on the social ecological framework, and we know that this will play an even bigger part in the next Healthy People initiative. So it's very important for you to familiarize yourself with that social ecological framework and the Healthy People initiative as future health promotion and wellness specialists, because this is not going to go away. The focus is going to be on promoting health and on setting objectives that focus on health promotion. So if these strategies come into play and the strategies are well implemented, we know that we can help impact tobacco, we can help impact diet, and we can help impact physical activity levels. And we also know that this can be a model to use for novel strategies to improve health in other major topic areas. That's all on Chapter 10. Please proceed to the module for your reading assignments and additional assignments for the module. Thank you.